There may be a lot of things that people don't know about pharmacists. We selected 5 different questions to ask and found 5 people in the community to find out what they have to say.
How much schooling do pharmacists require?
I guess it's about 4 years.
Oh, it's about 12 years. I think it's like college and then master's and then doctorate and then an additional 8 years.
4 years.
Oh, 4.
8 years, including college and then graduate school, 4 more.
Typically 4 years of undergraduate work, and at a minimum 4 years in a Doctor of Pharmacy program.
Where do pharmacists work?
Drugstores.
Drugstore.
Neighborhood drugstore, hospitals, all around.
The pharmacy, the hospital.
90% of the pharmacists in the United States work at Target right now, and then the rest are at the corner drugstore.
Actually, pharmacists can work in retail, hospitals, clinics, home health care facilities, home infusion facilities, long-term care facilities, managed care facilities, armed services, mail service, internet companies, public health service, Veterans Administration, local, state, and federal government, association management, community pharmacy, consultant pharmacy, pharmaceutical sales, pharmaceutical marketing, drug research development, managed care, universities, nuclear pharmacy, and numerous other settings.
What can pharmacists at your local drugstore do for you?
They can give you a lot of answers to what the drugs are for.
Answer questions that I might have about medications and fill my prescriptions. I can ask them for advice, or if I need to find that I don't know what I should take, they'll give me that information too.
I guess not the extent of it. I'm usually just in and out, pick up my prescription.
They are really good at letting you cut in line, especially if you tell them it's some sort of emergency. So that's been a big help, especially when I run out of ice.
Pharmacists ensure each medication is indicated, effective, safe, and convenient for each patient. They also educate and vaccinate.
How many people in the U.S. die annually from medication-related problems?
That's fairly high, I'd say 25,000.
Well, it was a number of years back. You guys would remember this, but most of the population of Southern California, and a good portion of whom died, had issues with tainted Tylenol.
I'm gonna say 1,000.
Not very many, I don't think.
Oh, I don't have a clue. I don't know.
There were almost 200,000 deaths.
What can pharmacists do to improve healthcare?
They can actually, I think, provide the patches that all of the Congress people should wear to tell them who their sponsors are. That way people would know exactly why they're voting the way they are.
You guys have no control over this, but I would say cost of drugs. If you didn't have insurance, it's very expensive.
Gosh. I have no idea.
Lower the cost of drugs.
I would guess that's probably out of their hands.
$178 billion is spent annually in the U.S. to fix inappropriate medication use. Pharmacists are in a perfect position to reduce healthcare costs by catching and averting drug therapy problems, saving the entire healthcare system money.